Okay, when you think about the most important parts of your body, what comes to mind? Probably your heart, your brain, maybe your lungs, right? But what if I told you there's this huge, complex, and absolutely vital organ you've probably never even thought about? Today, we are pulling back the curtain on the peritoneum, the abdomen's unsung guardian. See, this hidden structure is way more than just a simple lining. As you're about to find out, it acts as both a protective barrier and, honestly, a critical battlefield for your health. So to get us started, I've got a question for you. What structure inside your body has earned the nickname the policeman of your abdomen? I mean, something that actually patrols, protects, and jumps into action at the first sign of trouble. Well, the answer is a part of the peritoneum called the greater omentum. And this old medical nickname is just perfect because it totally captures its job. When something goes wrong, say a burst appendix, this fatty apron-like structure literally moves to the site of the problem and wraps around it, trying to wall off the infection. It is your body's own first responder. And this policeman is just one part of a much larger system, the peritoneum itself. You can think of it as this huge slippery sheet of tissue that lines your entire abdomen and then folds over to cover most of your organs, kind of like a really sophisticated, living, breathing version of plastic wrap. So what is this living wrap actually made of? Let's dive in and take a closer look at its microscopic structure. It's pretty cool. All right, if we zoom way in, you'll see it's not just one simple layer. On the very top, you've got the mesothelium. These are the super smooth surface cells that let your organs slide around. Right underneath that is the basal lamina, which is basically the biological glue holding it all together. And then, supporting everything, is the submesothelial stroma, a layer of tissue that's jam-packed with the blood vessels and nerves that make it all work. Now, here's a fact that's probably going to blow your mind. If you could somehow take the peritoneum out and lay it completely flat, its surface area would be about 1.8 square meters. To put that in perspective, that's roughly the same surface area as the skin covering your entire body. It's this enormous interactive surface just tucked away inside you. And this is absolutely crucial. There are two very distinct parts to this giant sheet. You've got the parietal layer, which lines your abdominal wall. It feels sharp, localized pain. That's the kind of pain where you can point with one finger and say, it hurts right here. Then you have the visceral layer, which wraps the organs themselves. It only feels stretch and chemical irritation, which our brains interpret as a vague, dull, hard-to-pinpoint ache. This difference is literally fundamental to how doctors diagnose what's wrong with you. And this whole setup leads to another key idea. Not all organs are treated the same way by the peritoneum. Some, like your stomach, are intraperitoneal. That means they're fully wrapped up and can move around. But others, like your kidneys, are retroperitoneal. They're fixed in place behind this lining. This simple classification explains why some of your organs can jiggle around while others are totally locked down. Okay, so now that we have a handle on the anatomy, let's get to the really good stuff. What does the peritoneum actually do? Because, let me tell you, it's so much more than just a wrapper. Two of its most specialized, most important parts are the omenta. Now, we've already met the greater omentum, our policeman that hangs down like an apron, but it has a partner, the lesser omentum. You can think of this one as the connector. It stretches between the stomach and the liver, and this is critical. It acts as a protective highway for the portal vein, the hepatic artery, and the bile duct, three of the most important pieces of plumbing in your entire abdomen. And the jobs just keep piling up. Seriously, it produces this lubricating fluid so your intestines can slide around without any friction. It forms the mesentery, that fan-like structure that literally suspends your intestines and carries all their blood vessels and nerves. It even has these tiny little pores called stomata that help drain fluid, preventing you from swelling up. It's a mechanic, a plumber, and a structural engineer all rolled into one. But of course, when something has this many critical functions, it's also at the center of the action when our health takes a turn for the worse. And that brings us to peritonitis. This is what happens when that policeman we talked about is completely and totally overwhelmed. If an organ like the appendix ruptures, bacteria just flood the normally sterile peritoneal cavity. This causes a massive, life-threatening infection of the entire membrane. It is a true medical emergency. Another really common problem is adhesions, especially after surgery. So when the peritoneum gets injured, the body's repair crew comes in and lays down this temporary biological scaffolding made of something called fibrin. Normally, this gets cleaned up and cleared away. But if it doesn't, that scaffold can become permanent scar tissue, basically gluing organs together that are supposed to be separate. This can cause chronic pain and even block up your bowels. Let's actually look at this whole process on a cellular level. So here, in this image, we have a healthy peritoneum. See how the surface cells, those mesothelial cells, are all neat and tidy and organized? This is our baseline, our before picture.
Now, let's introduce a stressor. This could be an injury, chronic inflammation, or even the high glucose solutions that are used in some types of kidney dialysis. These stressors can trigger a process called MMT, where those neat little cells start to transform. They lose their orderly structure and they start taking on the characteristics of scar tissue cells.
And this is the end result after long-term exposure. Those transformed cells start laying down all this thick, fibrous tissue. The peritoneum becomes scarred and stiff, a condition called fibrosis. And this thickening can seriously mess up its function, which is a major reason why peritoneal dialysis can eventually stop working for some patients.
Another really serious issue is something called ascites. Hey, remember those little lymphatic pores, the stomata that drain fluid? Well, when the balance of fluid going in and fluid going out gets disrupted, which can happen with liver disease or cancer, fluid can build up in the peritoneal cavity, causing this massive and really painful abdominal swelling.
So how does all this fluid just leak out? Well, a key culprit is a growth factor molecule called VEGF. When VEGF latches onto the receptors on the peritoneal blood vessels, it basically signals them to become leaky. It opens the floodgates, allowing fluid to just pour out into the abdominal space, and that's what directly causes ascites.
So, after seeing all of its incredible functions and all the different ways things can go wrong, it becomes crystal clear why this membrane truly matters in the world of medicine. I mean, the clinical relevance is just huge. We actually use it for dialysis, harnessing its network of blood vessels as a natural filter. We have to battle it when cancers use its surface to spread. Surgeons are constantly trying to figure out how to minimize injuring it to prevent those adhesions. And every single day, its unique nerve patterns help doctors figure out what's wrong inside a patient's belly. So, the next time you think about your body, I really hope you'll remember the peritoneum. It's not just a passive lining. It is an active, dynamic, complex organ. It's a protector, a facilitator, and a guardian. And it reminds us that sometimes the most important answers in health and medicine are hidden in the very structures we so often overlook.